Welcome back to The Price of Business. I'm your host, Kevin Bias, talking to you about you and your business. I've got my good friend Frank Granett on with me, and he and I have a project we've been working on together that I absolutely love. It's called The Price of ADHD Business, and it's a huge one. It's had a profound impact on the economy, profound impact on people, and what we're trying to do, done under the auspices of CAOOY.org, which Frank will introduce before he introduces his guest here in a moment, is we're trying to talk about balanced approaches and balanced ways of treating one of the most common and most pervasive issues out there, which is ADHD. And I'm looking forward to another discussion on it. We've got tons of video and, tons of articles and audio about it at USDailyReview.com and PriceOfBusiness.com, and we encourage you to check it out. And Frank, glad to have you on, sir. Tell us a little bit about CAOOY, and then introduce us to your guests.
Yeah, great to be on again, Kevin, with you. And CAOOY is the Coalition Against Over-Medicating Our Youth. We're a nonprofit educational public charity, and the mission of which, Kevin, and we've been doing this for a while now, is, like you say, we're helping parents help their children, get to the bottom root cause analysis or assessment prior to premature drug therapy. And to that end, we're forming alliances with many practitioners across the country that have been doing this and are embarking upon this mission along with us, and they've been doing great work across our country. And today's special guest is no different. He is Dr. Cady. And Kevin, he's from your neck of the woods. He received his medical degree from the University of Texas, and then he went on to his psychiatry residency at the Mayo Graduate School. And right now, he is doing so much at his Cady Wellness Institute in Newburgh, Indiana, to basically help young children and their families, get to this root cause analysis prior to premature drug therapy. And Dr. Cady, welcome aboard to the program today.
Thank you very much, Frank and Kevin. It's great to be on with you.
Yeah, and I do want to mention early on.
I got to ask you real quick, though, Dr. Cady. We talked in the past, but is ADHD a real, especially in young children, a real, true biological problem, and should we ever use medication as a primary intervention?
Frank, the quick answer is yes and yes, and I do. It is a real biological problem. It has clear biological roots. We can see it in terms of the inheritance patterns, difference in the dopamine active transport reuptake, which means that ADHDers are a little bit deficient in dopamine, which is the pay attention and focus chemical. And it is a for real diagnosis. All one has to do is go to Google Images and type in ADHD, and you can see the difference between ADHD brains and regular brains. That said, it's important to differentiate between what's true ADHD and what is an ADHD lookalike or masquerader or a boring teacher or nutritional deficiencies or too many video games or some combination of all of those.
Do you want to mention real quickly and early on, Cady Wellness is spelled CADY wellness.com. That's CadyWellness.com. And tell me, how long has the Institute been in existence, Dr. Cady?
We've been here since July 1, 2005. It was my dream to have a freestanding sort of medical psychiatric institute where we could focus on the holistic treatment of children, adolescents, adults, and even geriatric patients to precisely treat the underlying physiological problems and avoid over-medicating people.
Very good. Go ahead, Frank.
And you talked, Dr. Cady, we looked on what you've been doing down in Indiana and this neurovitality treatment process. Briefly describe, to our audience as far as what that entails, how you go about these assessments. When we talk about the physiological, the nutritional, as well as the environmental or behavioral risk factors, how you go about this treatment process.
Sure. It is a fascinating process. I must give a shout-out to my friend and entrepreneurial acquaintance, John LaDuca of the Wisdom Link, who helped me pull out of my head exactly what it is that we do here. The neurovitality process, which is now a U.S. Patent Office registered trademark process, is a 6-step process beginning with the wellness introduction, which is when the patient or patient's parents first contact my office. And it goes through an explanation of our process, forms that are filled out so I get a solid history before I begin even the intake process. And then the neurovitality interview is something that thoughtfully explores the medical and personal history, as well as any testing or any charts or labs that come to me that were done before the appointment, and we review everything right then. It's about a 2-hour process. The third step is body systems diagnostics, where we develop insight into neurodiagnostic, optimal mind-body health balance, and also, for adults, neuroendocrine clinical pathways that can affect the health or mental performance. In other words, I order labs and testing. I will sometimes use a quotient device which scores to the nearest 0.1 percentile a child or adult's attention, hyperactivity, impulsivity, and distractibility. The fourth step is therapeutic synthesis appointments. Now, this is where it gets fun. This is the adventure of solid clinical practice, where the patient comes back, you explain what you have found. You may commence medication at that time. Sometimes I commence it right at the neurovitality interview. I should say medication or supplements. And then we begin synthesizing everything that we've learned from the patient. Then the final two are fairly anticlimactic. The peak performance generator, the patient just keeps coming back over an extended interval in between appointments because I don't want to overtreat. And we just schedule those in response to progress in mental performance and physical health, and they're scheduled as needed. And then Wellness Alliance appointments, those are more for adults and people that are depressed. And I will sometimes see patients one time a year, and those are the Wellness Alliance appointments. They're proactively scheduled to support patients in their life's adventure. But for ADHD patients, and particularly those that I am treating with a controlled substance, I typically see them every 3 to 4 months.
I'm assuming that depression is probably pretty common with ADHD patients because of that dopamine issue.
It is absolutely huge, and you put your finger on a really good point. It's not just the chemical problems, as in dopamine deficiency, because as you astutely note, that's one of the chemicals that is responsible for mood. But one of the things that happens with ADDers is they have an experience of themselves as failures, screw-ups, in trouble, world's against them, can't fight City Hall, failure after failure after failure. Now, I'm not talking about all of them. There's some that have it mildly. But when you look at the psychiatric disorder prevalence in adults with ADHD, 35% of them have dealt with major depression, 40% with anxiety disorders, and 50% with substance use disorders. And those statistics are if they have not been treated growing up, because treatment modifies that and improves your odds of all of those conditions.
With that, we're going to have to call this segment done, and it was a great one. Frank Granett, he is with CAOOY.org. He co-hosts these great segments that we call The Price of ADHD Business. And our great guest today, whom I really enjoyed, Dr. Lewis Cady, and you can learn more about him at the CadyWellness.com. That's CADY Wellness.com. And wrap it up for us, Frank.
And thanks for being on again, Dr. Cady, and we appreciate the work you're doing down in Indiana. And for those of you who want more information, go to CAOOY.org and have a great day.
Thanks, gentlemen. When we come back, much more for you. I do want to remind you, best content here shows up over there at USDailyReview.com, and you're listening to The Price of Business.